It's your program of choice, Health Affair and AIT, a platform where we focus on public health issues, challenges of women and children with a view to find lasting solutions. I am your regular anchor, Ushuomo Wadanias. Our focus today is on Parkinson disease. We spoke with some experts and warriors living with the condition. It is a package you cannot afford to miss, especially now that the younger age groups are at risk. We'll be right back after the news segment. Please stay tuned. It is a gathering that brings journalists closer with researchers on a monthly basis at the Nigerian Institute of Medical Research, NIMA, to deliberate on diseases of public interest. With a lot of urban dwellers surviving on street-vended foods, the research reporting focus here is on the rising cases of foodborne diseases, with local samples collected from street vendors around Yaba and environs.
And the foods that we looked at, number one, abacha, fried chicken. We looked at okpa, what you call okpa. Okpa is like beans that the Igbo people eat. We looked at akara, we looked at moi moi, and we looked at smoked pala fish. We identified salmonella. Salmonella is a foodborne pathogen that causes gastroenteritis. And if not treated promptly and on time, it could cause a lot of chaos.
A lot of foodborne pathogens are now circulating in our environment because of people coming from different parts of the country into the cities. You see people defecating in the open. So I think education and provision of interventions are very important.
And we hope that apart from passing on the message to the man on the street, people in the legislature will also pick up whatever we are saying, so that when we go to them to ask for increased funding to do research, to disseminate information like this, they will listen to us.
Another area of focus was on Helicobacter pylori, a causative agent of peptic ulcer, gastric cancer, an infectious disease that has to do with inflammation of the stomach. Against the popular opinion that the disease is not curable, the researchers gave a comprehensive detail of the cure.
85 to 87% prevalence of Helicobacter pylori has been noted to occur in Nigeria and be treated and cured with antibiotics and over a period of 10 to 14 days. So, but most times people would take drugs 2-3 days and they don't get, when they feel better, they stop. And that is one of the problems of antimicrobial resistances in Helicobacter pylori.
Other findings include the regular outbreak of cholera with major hotspots like Lagos State, Port Harcourt, Bauchi, Kano, Kaduna, Abia, and Ebonyi State identified. Lakowe is a remote community in the Bejuleki area of Lagos State. Malaria is endemic in this community and other common diseases of public health concerns, which necessitated this free medical intervention by ISE, a non-governmental organization focused on improving health and productivity of women and girls in underserved communities.
The children are being tested, the women are being tested. These are the very vulnerable people in the society, and apart from that, even the men and women that are being tested and being exposed. So it's a whole lot.
Also, we are referring people who have health issues that we've seen at this program. We'll be referring them to care and following up to ensure that these people are living a healthy life.
Nigerian government is trying, Lagos State government, where we are, is trying to ensure that health is accessible and affordable. But as an institution, we believe a lot more can be done.
Beyond various medical interventions that covered free screening for HIV/AIDS, syphilis, malaria, high blood pressure, residents in the community were given talks and education about disease prevention, hygiene, and how to access care at primary healthcare facilities.
They need to prevent and protect themselves against communicable diseases.
Shun self-medication because the services they needed are widely available around them.
Someone will just be walking on the road and just collapse. It may be the rise of BP. And there are some other cases that can cause this also. But if you are above 40 upward, you take it as a priority. Know your status.
Advising relevant stakeholders on the need for greater collaboration to improve healthcare delivery at the primary level in underserved communities across the country, IC and partners believe that this is the only way Nigeria can achieve Goal 3 of the Sustainable Development Goals of universal health coverage by the year 2030. Figures from the Nigerian National Blindness and Visual Impairment Survey indicates a prevalence rate of avoidable blindness of 1.13 million persons. It also identified cataract, glaucoma, trachoma, and uncorrected refractive errors as leading causes. It is to change this narrative that this free medical intervention program in Oshodi, Solo area of Lagos State focused on eye care.
The thing I informed the eye care here is that a lot of people, they have eye issues and they cannot really go to the clinics for eye checks. So when we sat down, we talked about it, we saw that a lot of people are actually going blind. So they need glasses to read, but they cannot afford it.
Anybody that's in need of glasses, we begin glasses. If you're in need of, if it's your sickness requires surgery, they recommend you for surgery. The crowd of people, these are people who cannot go to hospitals. Medicare in Nigeria is very expensive now. So anybody that will have any way to help, if there's any way you can help people, you help them.
The process is not much. When you come in here, you take a number, for it to be orderly. When you reach your turn, they'll call you, you go. The doctors will ask you a few questions. Then you move to the people that they issue glasses. They will give it to you.
We have done this at so many wards, like Okota wards, Ejibo. We have done it 2 times, 3 times, and today is Ajawe State. Honorable Oshedu Okejo Onakalisi is the man to beat in this constituency, because among all the members representing us at Abuja, no one have done what he have done. We have not seen this before.
Comprehensive eye screening, free drugs, and eyeglasses were provided for over 1,500 beneficiaries.
We believe that our environment should be protected, and from the data I saw recently, about 15 to 20% of the entire waste in a place like Lagos is from plastics and plastic-related materials. Our message generally will be to use this as a call to action. We need more partners to work with us. We are really grateful to the partners that have continued to work with us for these past 13 years. But we need more corporate organizations, more individuals, more bodies, more platforms to join this push and drive for a cleaner environment.
The opportunity we have here is to bring different stakeholders together to address a common challenge: preservation of the earth. The month of April is the Earth Month. This is an awesome opportunity because across the globe, people are drawing attention for the need for us to preserve the earth, the need for us to embrace renewables, the need for us to invest in ensuring that waste is properly managed across the country and across the globe, ensuring that the air is pure, ensuring that the oceans are cleaner, ensuring that the land is also properly preserved. Where the environment is not taken care of, it is a major risk to our health. It's a major risk to sustainability of this environment. It is a major risk to the quality of air we breathe in. It is a major risk to the quality of seafood that we consume, because we know, based on statistics, by 2050 there are statistics that say that there will be more plastic in the ocean than fish. We are here to work together with different stakeholders to ensure that that statistic never becomes our reality. We have to act if we want to ensure that we all do not have cancer because we are consuming contaminated seafood.
We are cleaning the beaches, and based on what we have just picked up, most of the materials we have picked up are things that comes from the shore to the water body, And that is what Lagos State government have been saying. If each and every one of us continue to pick our waste, bag it properly, we won't have all these things by the beach. So in preparation for the rain, it is the citizen. The citizen have to join hands with government. We decided to set up the banning of the single-use plastic because 95% of what we pick today are things that are just single-use, from styrofoam to plastics to cutleries to cups that are used for drinks. So you see, government banning single-use is not to punish people, but also to reduce the effect. If all these things gets into our drain, they block the drain and ultimately cause flooding. So as we are going towards the rainy season, citizens must be ready to be committed with government. Let's bag our waste, patronize PSP operator. That is the only solution. We cannot be using huge amount of money every year to be cleaning the drain when we know that what gets into the drain comes from our homes and comes from our community.
I work for USAID funded Breakthrough Action Nigerian project, and I'm asking you to watch Health Affairs because it is an authentic platform for health information.
TB is a chronic infection caused by Mycobacterium tuberculosis. TB has symptoms like cough of two weeks duration, weight loss, night sweat, hemoptysis, fever, and chest pain. TB can be prevented. TB is curable. Taking your drug for 6 months, you'll be free of TB. You'll be totally free of TB. And lastly, the diagnosis and treatment of TB is free.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affairs, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affairs, your access to good health through relevant information.
Welcome back. In June 2022, the World Health Organization, WHO, launched a technical brief on Parkinson's disease, highlighting it as an urgent public health issue, with more than 5 million people above the age of 65 at risk. Listen to our experts and Parkinson warriors on this episode of Health Affairs. Joseph Oluwatayo was a vibrant cleric, but his life took a different turn with the onset of Parkinson's disease in 2023.
I thought it was just a malaria fever. So I went to the hospital for treatment. When they treated me first time, second time, and I began to complain that I'm not feeling the malaria fever symptoms, that there must be something else. So they now referred me to Lutz. So it was Lutz. It was in Lutz they discovered it is Parkinson. I've never heard about Parkinson before until they said it is Parkinson. Then I begin to ask questions, what is Parkinson all about? So they made me to understand that something was missing in my brain. So, and they said it is not curable, that we can only manage it. And since then I've been battling with it. I'm a clergyman. Now I cannot all that stand in the public again. Except I just have a contact one-on-one with somebody before I can discuss with that person. You know, before I used to do crusade, I used to go out, but I cannot do that well now. I used to do morning cry, I used to do more preaching, everything like that. But you know, I cannot stand for 1 hour, 3 hours again.
Like Olutayo, many Nigerians in their early 40s are beginning to manifest the symptoms of Parkinson's, a disease hitherto associated with the elderly.
Yeah, 2016. That's going to 9 years now. Initially, my wife and my brother said I'm acting slowly. I'm moving slowly. When I want to do things, I didn't notice it. I didn't think I was moving slowly. But I noticed that anytime I want to open the door of my, I find it difficult to coordinate and put it into the keys into. It's always it's always difficult. So I said I was wrong. So I did many tests. I did MRI. I did so many because Parkinson wasn't what they were thinking of because it's usually rare for people my age. I just turned 40. Yeah, just turned 40. I'll be 49 this year. So they were doing other tests. I did the MRI. I did colonoscopy. I did all sorts of tests. Then my doctor then suspected Parkinson. He now said I should take. He should now prescribe drug for me. That if I take the drug and I react to it, and at that time I was also getting slower, and so I was always having constipation. So you know, if I react to this drug, it means he suspects I have Parkinson. I'm a lawyer. I used to work in the bank before, but I stopped working. I now work for myself. But initially it was okay. I could manage with the drugs, drive, everything. Life didn't really change so much for me in the initial stage. But as the disease was progressing, I couldn't. It was very difficult for me to wake up early, go to work, and because I was always stiff and rigid. To me, I feel it's a lonely disease. What I mean by lonely disease is that there are very few people that have Parkinson's. Before I joined the Desalu, I don't think I know any other person that had Parkinson's apart from my late uncle and my late auntie. They both had Parkinson's. You know what dopamine is? Dopamine is the chemical in the body that gives joy, satisfaction. Number one, the dopamine is depleting from your system, so from the get go, the Parkinson is going to make you depressed, and nobody understands it more than you. But with the community, you see people like minds like you can talk about it, and it has restricted my life in a way because I have to be on medication to do most of the things.
I just felt a twist in my right hand, and I observed that I couldn't write properly. My handwriting was becoming smaller, and then I was working with computer. I couldn't type very fast. I could barely brush my teeth by myself. I found it difficult to stir food while I'm cooking and to bathe myself, to use sponge for myself. So I started visiting the hospital. They did not diagnose me on time because of my age. They looked at me like I was pretty much younger. It started at the age of 38, when I was 38. So I found it difficult to do some certain things, day to day chores I used to do before, washing of clothes and all that. So when I got to the hospital, I explained to them. They gave me some muscle relaxant, asked me to go for physiotherapy and all that. It wasn't solving any problem at all. It started moving from my right hand side down to my neck. I felt stiffness, weakness. Then I get so easily tired. I was not having tremor at that time. So before I got diagnosed by a neurologist and a consultant who diagnosed me that it was Parkinson based on the physical examination and scans that I went for, brain MRI scan, and of course I did some CT scan before then. The difficulty in doing other things died down after I started using the medication. I found relief because now I know that this medical condition has a name and there's something I can use to manage it.
Parkinson's is a degenerative condition of the brain associated with motor symptoms, tremors, shaking of the hands, poor posture, and walking imbalance. In June 2022, the World Health Organization launched a technical brief on the disease, highlighting it as an urgent public health issue.
To diagnose Parkinson's, it takes a neurologist or a movement disorder specialist, because no doctor will just want to tell you that you have a disease that don't have a cure all of a sudden because you are presenting certain symptoms. So a neurologist, what we do at the Adewunmi Desalu Parkinson's Foundation is to refer people that present symptoms to a neurologist in the teaching hospital where they get the proper diagnosis, and we provide the rehabilitative care to ensure that they slow down the progression through our various programs. And it's important that these people get the diagnosis on time. Perhaps these are one of the reasons why we have limited number of people presenting that they have Parkinson's. Meanwhile, we know quite all right with what we've seen with our outreaches and with our communique that we've put out there, that people have Parkinson's, but they don't know exactly what they do have. It is better when you get diagnosis on time and start treatment so that you can slow down the progression. It progresses with time. But we've had people that have lived years with Parkinson's and they've been functional despite the tremor, despite the slowness.
I've seen them, people that have had issues, that have come with very terrible issues. As time goes on, they get better. That's one beautiful thing I like about working with them. Yeah, so with much diligence from them, giving them exercise regimens. It's been beautiful working with different conditions, different people with different severities, different stages of Parkinson's. We have stage 1, stage 2, stage 3, stage 4. And we see people come from stage 4 to stage 3, from stage 3 to stage 1. See people get better. So it's been a beautiful experience for me as a medical practitioner.
Beyond the challenges of access to care and non-availability of government centers to cater for persons with Parkinson's disease, the high cost of medication and stigmatization are some things they will want addressed.
We would like government to start prioritizing people with neurodegenerative diseases. The medication is very expensive. If government can provide a subsidized medication for people with Parkinson's, it will go a long way. That's one. For the public, if you see somebody with Parkinson's, please refer them. Don't stigmatize them. They may be slow, but that is not the way they are. You can help them by referring them to the right place. Like our center is open and we provide pathway for referrals to get diagnosis and to also slow down the progression through our various rehabilitative care programs.
And I would appeal to the government to help us provide something like an ID card that will be approved by the government that we can use to move around. Maybe when we are in a place where it's too crowded and we need to be attended to, we can tender it to the facility or to the organization where we find ourselves. And another thing, if there's anyone among us who can still work, who feel they can work, they are still strong enough to do some jobs for themselves, the government should provide an opportunity for us to be able to work in the government section.
Next on the program is our Women and Children's Corner.
The situation of child deaths in Nigeria is pathetic. We have remained static, I will say, between 2015 to date. That's almost 10 years. Because at the end of the MDGs, our child mortality was such that 1 in 9 babies born in Nigeria die before the age of 5 years. And I'm looking at the 2024 NDHS, the figures are still the same. In fact, it's worse a little, because now they are quoting 1 in 8. What that means is if you visit a maternity center and you find 8 babies born, 1 of those 8 babies will not live to celebrate the 5th birthday. It's terrible indeed. There could be many factors, but I want to start with the homes. If families do not have the wherewithal to care for their children adequately, they are not likely to get out of this. What I mean by that is that, one, if the mothers are not empowered to even care for their babies properly, if they do not have the required information on where to seek appropriate care, particularly during pregnancy and for delivery, you'll have this same situation.
On our nutrition segment, we are concerned about your eating right to stay healthy.
Beetroot is one of the healthiest vegetables. It is the taproot portion of the beet plant, mostly grown for its edible taproots and leaves. Beetroot, also known as blood turnips, apart from being used as food, is a medicinal plant that has been used for ages in the treatment of numerous conditions. Though beetroot comes in different colors, red is more common. They can be eaten raw, as juice, or eaten as salads. The health benefits of this wonderful plant has been widely researched. Beetroot, due to its low sodium, fat, and high folate content, supports mental and emotional well-being. Beetroot, according to experts, may delay signs of premature aging. It can promote skin, liver, and brain health. It is beneficial during pregnancy. It lowers blood pressure, reduces the risk of heart diseases, aids in cancer prevention, helps fight inflammation, reduces bad cholesterol, levels the risk of diabetes.
Join us on our clinical segment for tips on healthy living.
The first thing is sanitation and information. So we are paying attention to your sanitary conditions, making sure you have enough water, making sure that you wash your hands regularly. You must always maintain distance between yourselves.
This is where we draw the curtain on the show today. Please join us same time next week for another interesting edition. I remain yours truly, Oshomowa Daniels. Your health is your wealth. Please give it your best. Endeavor to go for medical checks even when you don't feel sick. It is a secret to early detection and prevention.